But I want to start with a really 101 question and ask you, what is the difference between a headache and a migraine?
That is such a great question. First of all, thank you for bringing me on because this is a really important topic. I make a new diagnosis of migraine every day in my clinic. So, as you shared, I'm a neurologist, I'm a headache subspecialist, and I spend a lot of time seeing patients. And the main question that they have is, how do you know I have a migraine and how is that different from headache? And the big thing is migraine is so much more than just head pain. First of all, we do diagnose it based on headache symptoms. So there are formal diagnostic criteria to make that diagnosis. It's every headache diagnosis we make is based on something called the International Classification of Headache Disorders. So it all comes down to talking to our patients, listening to their story, truly listening and seeing if their symptoms sound like migraine. But in a nutshell, people need to have a recurring headache problem where the pain is moderate to severe, can limit them from activity, and they can have other symptoms along with that, like nausea, light or sound sensitivity. That's basically the gist of migraine.